Okay, well, you kind of dabbled on your story and when your health started to truly decline. Would you mind expanding on
Yeah,
that?
absolutely. So I was 20 years old, and I was a relatively healthy person. I was in college. I was from at that time, I would call it in the prime of my life. The best time I was having, I was with my friends. I was in college. I was playing hockey, and just having a great time overall. And I got a really bad ice hockey concussion, and the concussion left me with blurred vision, headaches, dizziness, hand tremors, anxiety, depression. And I
Wow.
got the concussion on a Wednesday, and the symptoms didn't show up until like the next week.
Oh my,
So
whoa.
it was a little bit tough for me to connect the dots on what was going on, because my health just, I woke up one morning and it was the worst I ever felt, and the symptoms weren't going away. So I was really scared. I thought I had a brain tumor.
Whoa, whoa.
And So I did what most people would do in that situation. You go see your primary care physician. They send you to the neurologist. Most people at that point were telling me, you know, just rest. Your
Yep.
concussion symptoms will go away in 2 or 3 weeks.
Yep.
And after 2 or 3 weeks, I actually felt even worse.
Oh no.
And they told me to wait another month. I waited another month, and I was getting progressively worse as the weeks were going on, not getting better, and I wasn't getting any answers. So
Hmm.
I ended up seeing couple more neurologists. They put me on seizure
Oh
medications
my
because I
gosh.
told them my hands were shaking
Oh,
and I couldn't sleep at night. I used to have to put both hands under my pillow to help them from stop shaking.
oh no.
Um, and I told them I was in a severe amount of pain all the time. So they put me on painkillers. And I told one doctor that I was just, you know, severely depressed. Not that I was a depressed person. Just these symptoms were making my life intolerable.
Yeah.
And they put me on antidepressants.
Oh God.
And so I was on a cocktail of
Oh
medications.
no.
And what somebody also did, what the doctors didn't tell me, is these medications have side effects.
Yep.
So when I was taking the antidepressants, I was actually having more suicidal thoughts.
Oh
Like,
gosh.
I remember I was actually seeing a regular chiropractor at the time, and I told her, "Oh, I'm on antidepressants. Like, I don't think the medication's working because I'm feeling more depressed and more suicidal." And she's like, "Well, you know what? Maybe they are working." And I was like, "What do you mean?" And she's like, "These medications have side effects, and sometimes it makes you feel even worse." And I was like, "Oh, wow, you're right. I didn't even think about that." So I completely stopped taking all the medications I was on, which I don't recommend. You're not supposed to do that. But
Right.
I didn't know what to do. And I drifted into a very dark place because I was not getting any answers from these brilliant people that were telling me to rest. A lot of people were saying, some even doctors thought I was lying to them. They're like, "Kevin, it's all
Oh.
in your head.
Oh
Like,
gosh. Wow.
there's because my MRIs were coming back fine, the CAT scans were coming back fine, blood work was coming back perfect, and yet I felt like I was dying on the inside. I felt like I was in a mental prison.
Wow.
So you know, you get all the tests back, and they're like, "Kevin, there's nothing wrong here." You know, it was almost like you're making this up. Or some people told me I had a traumatic brain injury and I was going to have to live with this for the rest of my life.
Oh,
And that's very, very scary to hear at 20 years old, when you should be thinking you have your entire life ahead of you. I was gearing up for a long, miserable life.
wow.
My relationships with my friends really really took a turn and diminished because I didn't want to go out. I didn't want to talk to anybody. I was in so much pain all the time. All I wanted to do was really sleep.
Mm.
So the last 2 years of college, I kind of just locked myself in my room and just waited for the day to pass so I can go to sleep, because that was the only time I got any relief. And
Wow.
on a good day, I felt awful. I would have like maybe one or two neurological symptoms, and
Oh
on
my
a bad
gosh.
day, I wouldn't be able to get out of bed.
Yeah.
And there was one day where I would wake up. I would have severe knee pain when I'd wake up, like unexplainable. And I remember I woke up and the knee pain woke me up, and it was like 6 months in a row with just no relief at all. And I woke up and I was like, I cannot take I cannot take the pain anymore. I'm physically done. I'm mentally exhausted. I'm a
Hey,
pretty
Kevin.
positive person. Yeah.
Kevin, my
Yeah.
volume just stopped working. Can you say something?
Hello?
Oh my gosh. Okay. 1 second.
Yeah, no worries. Take your time. Can you hear me?
All right. Can you
Can
hear
you hear me?
me? Yes.
You can?
Okay. Yeah, something happens when I put my headphones in with Zoom and the volume goes down. I literally have like a crystal holding the volume button down and it fell off and it wouldn't fix itself. So,
That's
all
great.
right. Where I heard you last was you were like, on a good day, I would have,
On a
you-
good day, I would have like one or two neurological symptoms, and on a bad day, I wouldn't be able to get out of bed. The pain was too exhausting.
wow.
And for about 6 months straight, that was my life. And I remember, like, it's like it's like the Twilight Zone.
Mm.
Every day is the worst day of your life, and you
Oh,
can't figure out why.
wow.
And I remember, and did you hear the part where I was talking about my knee pain?
No.
I would have very unexplainable knee pain every single morning. It would wake me up around 7 a.m. And I remember 7 a.m. one day, I wake up, the knee pain is like unbearable.
Mm.
I roll over on my side, and I just remember being physically just exhausted, mentally exhausted,
Wow.
absolutely hopeless. And I remember for the first time in my entire life, I didn't want to live anymore. I was just mentally and physically exhausted. And
Wow.
for the first time in my entire life, I thought about just ending it that day, because
Wow.
I couldn't take the pain anymore. It was too much. And I remember sitting up, and I just started kind of bawling my eyes out, crying for a couple minutes.
Oh
And
man.
then I just kind of collected myself and figured that wasn't the answer. I really needed to see this through. And from that day forward, I was going to do anything possible in my power to feel better
Yep.
and get better. And so I mentioned this in one of my first podcast episodes. I would do anything possible. So if you told me you had an answer, I was going to go seek it out and at least see if it was for me.
Mm-hmm.
And so I went to go see a priest. I went to
Oh, wow.
Catholic University with a big basilica on campus, and I figured, you know what? Maybe I'll go see this priest. He might throw me a couple Our Fathers, Hail Marys, sprinkle some water on me,
Yep. Who
and
knows?
maybe something will happen. And I remember going to see the priest, and I walk in, and the guy had a pack of cigarettes on his desk, full grizzly beard, and he was the first person in years to just sit down and meet me on my level. It wasn't a doctor talking down to me. He wanted just to hear what I had to say, and just hear me. And sometimes when it comes to healing, that's half the battle with some people. Some people just want to be heard, because some doctors don't even listen to you. They just
Right.
want to throw the scripts and the pills at you and be on your way. But this guy really sat me down, listened to me. And after I got telling him the same story I'm telling you right now, he said, you can do all the hoping, wishing, praying in the world, but if you don't go out there and find the root cause of this problem, you're never going to get better. And I
Whoa.
was pretty shocked. I thought he was going to throw some religion at me
Yeah.
and stuff like that. And he brought up a good point. He said, out of all the people that have been on this planet, there has to be at least one person that has gone through the same thing you have gone through. Find that person. And if you can't find that person, be the first person to beat it.
Wow.
You gotta stop feeling sorry for yourself, and you
Yep.
really got to do everything in your power to be healed. And I remember I remember getting out of that meeting just a little shook up. Like
Yeah.
I didn't know what happened. I knew he was right, and I knew I had to really take matters into my own hands. So one of the first things I did, I called an professional hockey player who had concussions and was doing pretty well at that point. And I talked to him on the phone, and he led me to a osteopath that was doing platelet-rich plasma
Mm,
injections. Have you ever heard of
mm.
those?
No.
It's where they take your blood out, they spin it around to create platelets, and
Wow.
it just stimulates healing. And so they take your blood out, they spin it around, and they inject it back in you. And the needle it's huge, and I was getting it right around the brainstem.
Oh.
And
Oh, wow.
so I remember this doctor was the first person to tell me that he can get me better.
Wow.
And um, and I remember he was looking at my mom and I, and my mom just started, she lost it. She started
Oh.
bawling her eyes out crying, because when you have an injury like this, it affects the entire family. And
Yeah.
I didn't know that. And when I saw my mom crying, I was like, wow, I really got to get better here, because not only am I suffering, everybody around me is
Mm.
feeling my pain too. And that was a lot for me to take in. So I was like, if you can tell me you can get me better, let's do this,
Yeah.
because I need something. I need a miracle right now.
Yeah.
And so after the first injection, I felt really good. My brain fog lifted. I
Wow.
felt normal for the first time in 2 years.
Oh my
Um,
gosh.
Unfortunately, it didn't last. I woke up the next morning, and it was kind of back the same way. But I got that like 10 hours of where life was good again, and it
My
was
gosh.
the veil was lifted, and he did something. And to make I spent a good amount of time with that doctor. Great guy. The shots ended up they didn't work for me, but he was the first doctor to tell me posture dictates function, and if you clear out the interference around the brainstem,
Mm.
you'll be able to heal. So that kind of stuck with me. And all this whole time, people were telling me, a lot of the doctors were telling me, whatever you do, don't see a chiropractor. Just promise me you're.
What?
So I didn't get any chiropractic adjustments for like 2 years, because these doctors were telling me, and fair enough. I do agree with them to some point. You know, you see some chiropractic videos and people are getting their necks cranked one way and the other way. So I'm not a fan of that type of chiropractic, and
Okay.
that's probably what they were thinking. So I agree with them now I agree with them in some sense. But um, I ended up going to see that doctor I was telling you about in third grade, the one I grew up seeing.
Mm-hmm.
And he got me about 60-70% better.
Oh,
I was
wow.
I was seeing him about 3 or 4 times a week, which was pretty excessive for like a year. And he was getting me functioning again, which was great. But if I
How?
didn't see him for he was doing so he was doing specific upper neck adjustments, um, and he was doing this chiropractic technique called CBP, chiropractic biophysics, where they put a thing around your neck and they try to restore the neck curve. And it was helping, but it wasn't staying in place. So if I didn't see him for a week or two, all my symptoms would come back. But
Mm.
I would take that over being absolutely miserable for like I was.
Yeah.
So I kind of figured there's something to this chiropractic thing. It's getting me somewhat better. Let's go study it and see
Mm-hmm.
if we can heal myself here. So I moved out to California,
Mm.
and sure enough, after 2 or 3 weeks, my neurological symptoms all started coming back: brain fog, blurred vision,
Wow.
dizziness. And thought I was gonna have to get ready to drop out of school again and
Right.
go home and just call it quits. And literally, what I thought was going to be my last week at chiropractic school, my friend who was tutoring me, which was about a year ahead of me in chiropractic school, said, "You don't look good today. What's going on?" And I remember telling him, "Oh man, I have headaches and blurred vision and dizziness again. Like I think I'm going to have to drop out of school and just go home." And he goes, "I think I might know one person that could help you." And I said,
Wow.
"All right, I've heard this before. Like I said, if you tell me you can help me, I am going to knock on that door and see if it's for me." And so, like I said, I thought this was my last weekend. I went into that office thinking this is just another treatment. Um, who knows if it's going to work? And I remember turning the corner, and on his office door it said expect miracles, and
Oh.
that just kind of grabbed my attention and really made me think I was in a true place of healing. And it's funny how the universe works, because I'm sitting down with this doctor telling him the same story I'm telling you, and he's laughing. He has a big smirk on his face, and I am just kind of depressed, and I'm looking down and kind of looking up, and then I notice this guy's laughing, and I'm like, what the hell is so funny? This is not a funny story. And after I'm done telling my story, he said, Kevin, I had the same exact story as you. I was wrestling my friend on a baseball field.
No
He was
way.
losing the wrestling match. His friend picked him up, dropped him on his head unintentionally, and he heard a huge crack under the base of his neck, and he thought he was paralyzed. And after 5 or 10 seconds, he wiggled his fingers and everything, and he realized he wasn't paralyzed. And he just got up, started living his life again. And then about 7 or 8 months later, all the same symptoms I was describing before, he had. And so he found what I do now, which is called Blair Upper Cervical Chiropractic. And it's a specialty within the chiropractic field. They focus on the first 3 bones in the neck, right where the brainstem is. And they take very precise 3-dimensional x-rays, and they put everything back into alignment down to the exact millimeter. And we say holding is healing. So our goal is to give you one neck adjustment, which is huge, because I used to go to the chiropractor 3 or 4 times a week just to get checked. And our goal is to give you one neck adjustment and have it hold weeks to months to years, which it can. So everything he was telling me, I was like, wow, this seems phenomenal. This is perfect. But I have heard people say they're going to get me better, and it's failed. So you need to show me the money here. Let's see if this is really going to work. And they took the x-rays and they laid me on the table. Well, he laid me on the table, and I never had a doctor talk to me like this. Excuse my language. He said, lay down on the table. I'm going to save your fucking life today. And I was like, wow, I've never had anybody talk to me like that, but I kind of liked it. And I was like, all right, let's go. And so he laid me down, he adjusted me, and it's so light and gentle. There's no twisting or cracking. It almost feels like they didn't do anything. Like it feels like he tapped me on the neck. And he's like, I'm still laying on my side. He goes, how you doing? And I felt a very warm sensation under my ear, like the blood flow going back to my head that was cut off for so many years.
Oh my
I said,
gosh.
I think I'm feeling pretty good. And then he got me up, and I remember standing up for the first time, and the first time in countless years, my anxiety and depression like went away almost immediately. I felt like I was at ease for the first time in like 4 years. And they after these adjustments, they rest you in the back room to let everything rebalance. And I felt a universal force, a life jump back into my body. I felt connected to a source again that I haven't felt in a very, very long time. And I left the office, and the colors on the trees were brighter and greener. And I remember getting home that night, and I was like, wow, I don't know what this guy did, but I am feeling phenomenal. And one thing I left out of my story was I didn't really sleep through the night too well. For like 3 or 4 years, I didn't sleep soundly through the night. I would wake up, toss and turn, and then that knee pain would wake me up really early. So I was just constantly exhausted. And I remember my head hit the pillow that night, and I woke up the next morning, and it was the first time I slept through the night in like a long time. And I remember getting up that day, and with every fiber of my being just being like, this is what I need to do for the rest of my life.
Oh wow.
Now I didn't heal overnight. I had a couple great days, but true healing does take time. And it was a little bit up and down roller coaster ride for a little while, but every week something would get better and better and better until about 6 months down the road, I kind of looked in the mirror and I was like, wow, I don't have headaches. I don't have brain fog. Uh, my life is back. Like I'm back. And it's waking up every day, just the it's the worst day of your life. You have such an appreciation for life when you wake up and you don't have any neurological issues. You're clear, you're connected, and it was the worst time of my life, but it also the light at the end of the tunnel, I wouldn't have it any other way, because you have such a profound appreciation for life and being healthy. And when you see people walk in, like when people walk into my office now feeling the same way I felt all those years ago, I have such an empathy for them and I know where they've been, and I do everything in my power to help remove the interference that's going on in their life and try to just restore everything. And when they get their life back, it's why I do it. It
Wow.
never gets old. It's such an amazing thing to see. And I mean, every time I tell this story, it still gets to me. And it's a powerful adjustment. It's very light, but powerful, meaning like life changing. And I am forever grateful for it, and it's the reason why I do what I do today.
Wow. That was an amazing story. Thank you so
Yeah,
much for telling it.
you're welcome.
So, at the end of the day then, what is it, or what was it, at least for you? Do you know what happened? What was the case?
So I've probably had about 5 or 6 ice hockey concussions. I probably undiagnosed. I had about 3 or 4 diagnosed concussions, 5 or 6 times where I remember really hitting my head playing ice hockey. 2 or 3 more times just growing up, being a dude,
Right.
tackle football, just I played a bunch of sports growing up. There's so many times where I hit my head, skiing,
Right.
sledding. And so there's no disc space at the top of your neck between C1 and C2 like there is in the rest of the spine, and your head weighs about 10 to 13 pounds. And when you have little traumas, car accidents, sports injuries, falling off the monkey bars when you were a kid, it's very easy for those top 2 bones to lock out of place.
Mm.
And when that happens, the brain can't communicate with the spinal cord and heal itself anymore. And that's where the nerve flow and blood flow get cut off, and concussion issues set in, chronic fatigue, neurological disorders. And it's tough for people to connect the dots because the body is so good at adapting and
Right.
healing that even if it locks out, your body does such a good job of trying to get the blood flow up another way that your head tilts, and people don't feel their symptoms until years later. So I have so many patients that walk into my office and say, I just kind of woke up one day and my ears were ringing and I was vertigo and off balance. And usually we find that these injuries happen long before the symptoms show up. So you could have had an injury when you were 5 years old, and you can be getting chronic severe migraines at 20, 30 years old that just show up one day, when in reality your body was just so good at adapting, and then it just has enough one day and the symptoms
Yeah.
show up. So it was definitely from ice hockey. It was definitely from those concussions. And what showed up was the first bone in my neck. And when we say people are out of alignment, we're talking millimeters. Like it's
Yeah.
very small, but it's enough to
Wow.
put pressure on the cord. So my first bone in my neck, the atlas, was going a little bit backwards, and my C2 and C3 right under that were going forwards. So it was like somebody was just wrenching a cloth around my brainstem. There wasn't enough nerve flow and blood flow getting through to my body,
Damn.
and I was suffering immensely. And uh, I didn't know about this I suffered for 4 years, like 4 years. Nobody told me about upper cervical chiropractic. And I saw one, like, before we were talking, like, why did you want to start a podcast?
Mm.
The reason I wanted to start a podcast was because if somebody gave me some of this information 4 years ago, I wouldn't have had the worst 4 or 5 years of my life. I would have
Yep.
had some part of my life back, which it was a blessing at the same time because I did come out the other side. But I know what it's like to Google symptoms and have like just be scared out of your mind. I remember Googling post concussion syndrome, and worst case scenarios always pop up. You're
Yep.
going to have to live with it for the rest of your life. There's no
Yep.
cure. So what I'm trying to do, my goal, I'm trying to add value to whoever needs it and spread the message that um, there are answers out there, and it might not be in the mainstream Western medical route. So if I can make anybody's life easier by telling my story, by inviting other holistic doctors on, healers, people with amazing life stories on my podcast. It's called Expect Miracles. And
Oh,
if I can make anybody's life easier through that, I think I've done what I've came to do. And it's just about getting the information out there because you keep knocking on doors, one will open for you. And that's exactly the message I'm trying to get through to people.
wow. I love that. I honestly didn't understand chiropractics before this conversation.
Yeah. So the chiropractic I do, it's a specialty within the field. Only about 5% of chiropractors do it. Um,
Wow.
because it's very specific. It takes a couple of years to really learn and get down, but if you take the time to learn it, you will see miracles happen in your office all
Yeah.
the time.
Wow.
So there's not a lot of people doing it, but if anybody that is listening wants to find an upper cervical doctor near you, you can go to uppercervicalcare.com, type in your zip code, and see who the closest person is to you, and you can even reach out to me. I'll let you know if they're any good, and I'll direct you to the closest person to you to help get you better.
I honestly just had that thought. I was like, I wonder if there's one in Maui. So,
There's a couple.
really?
There's a Facebook group that a couple times people were searching for some doctors, some upper cervical doctors in Hawaii, and I think there's like two or three.
Wow. I
Yeah,
would love to try it. I'm so
yeah.
interested now.
So
I
I will
mean,
get you that information after,
thank
definitely.
you. I would love that. Yeah, I just love, I mean, I love this what is it called? Line of chiropractics. Is that what you call it? Just
Yeah, like niche
niche.
specialty. Yeah,
Yeah, it's so interesting to me because it does, you're so right. It does, it almost seems more spiritual, right? Because it is connected
yeah,
to the brain, and your brain equals your experience here on this planet. So it's like if something is messing with your brain, then yeah, your experience will be
yeah.
warped.
The uh the guy that founded the technique, his whole BJ Palmer, his whole message was healing happens from above down, inside out.
Oh, ah,
So it's definitely he was a spiritual dude. He was a great guy, and yeah, that's it's pretty in tune of your podcast and everything you've been preaching too.
yeah. Oh, I love that. So, how exactly do you, I mean, how do you move these bones? How does one go
Great
about moving
question.
bones?
So, I have it's called a cone beam CAT scanner in my office, and you might see them at the dentist's office where you sit down and it goes around your head and it
Mm-hmm.
reconstructs a three-dimensional image of what your neck actually looks like. And so we have an analysis of what we do, and we figured out which segments are out of alignment, which way they moved out of alignment, and we use a very special table to do the adjustment. So you're not laying on your back. There's no twisting, cracking, or pulling. You're actually laying on your side, and it's different for everybody depending on which side your misalignments are on. And we actually measure your joint angles. So we actually hold a protractor. Never thought I'd be using one of those again. But we measure the joint angles. You put it over the patient's head, and it's a nice light tap on the neck, and it's so specific that when the table drops, it slides it right back into place.
What?
And as I said before, some people, like I've had people that said, "That's all you're going to do." I said, "That's it." I get them up, I rest them. They come back in my office. They're like, "I don't know what you did, but I am feeling pretty good right now. So
Wow.
that's kind of what I liked about it, because it's so light. I never liked getting my neck cracked. It always felt like weird to me. I never really got any. I might have gotten relief from it for an hour or two, and then all my symptoms would come back. But and that's another great thing about this technique is I've had people come from very far away, different countries, different states, and sometimes I only have 1 or 2 chances with them, and I'll get them adjusted, and they'll come back 4, 5, 6 months later, and that same adjustment I gave them is still in place.
Wow.
And what that means is their body can continue to heal without me. I was
Mm.
always reliant on another person, another doctor to get me better. When once this is put back in place and it stays there, you become your own doctor. The body continues to heal without the
Amazing.
presence of someone adjusting you.
That is so, the body is so beautiful.
Oh, absolutely.
So as the patient, can you feel the adjustment? Does it hurt?
Yeah. No, well, it usually doesn't hurt, but some things people like report almost immediately. It can get a little warm under your ear
Oh, okay.
because the blood flow that was cut off starts going back to your head. You might feel a little like tingling sensation going down the body in a good way. You might feel lighter, clearer, more connected, um, boosts of energy that you haven't felt in a while. And also, some people get pretty tired after these adjustments because there was so much tension and pressure on the nervous system for so long that once you remove it, after the first adjustment, usually people sleep a long time because their body is no longer in that fight or flight sympathetic nervous system mode. They want to relax and heal. So you get really tired, you get a really great night's sleep.
Mm.
Um, yeah.
Wow, I would love to try this. Yeah, I've had some issues, I've had a lot of issues with insomnia, really. Um,
Oh, yeah. See a lot of
so
insomnia patients.
yeah, super intrigued. Question, personal question. Do
Yeah.
you ever see people for the sake of taking care of their menstrual cramps?
Yeah.
Does it help with
See,
that?
yeah. So,
Wow.
menstruation cycles, pregnancy,
Wow.
yeah, infertility issues for sure, because it really works with almost everything
Wow.
because like I said, this is the gateway to our health. Every
Brainstem. Right.
nerve passes right through here. So
God.
if there's any interference up here, there's nerves all over the body that aren't getting that 100% nerve flow. So once you open
Damn.
it back up, anything is really possible to heal.
Wow.
I've had very bizarre. I'm one of my favorite stories is I had this woman that went to China. She came back and she had this awful rash all
Oh
over her
no.
face. It wasn't anywhere else. It was all over her face. She went to all these doctors that were giving her these creams. She tried all uh, these natural oils and everything. Nothing seemed to be working. And I told her, I was like, listen, I've never seen this before. I don't know what this is, but I do know that once we clear everything up, your body will have the best opportunity to heal. So I gave her the adjustment. She came back a week later. I was like, "How you doing?" All I did, I gave her the adjustment. I told her to put some coconut oil on her face just to because it's antimicrobial, antibacterial, antifungal. So I said, "Come back in a week." She comes back in a week, no change. So I said, but she was still holding that same adjustment I gave her. So I said, okay, everything's good. She's like not thrilled because the rash is still there.
Yeah.
I said, all right, you're holding. Come back in 2 weeks. Come back in 2 weeks. Maybe it's a little bit better, not too much. And then I remember she came back around the 4 or 5 week mark and it was completely gone. It was
Wow.
completely gone. The only thing she did differently was get upper cervical adjustments. And, the power that made the body heals the body. We just removed the interference and her rash was gone. She's referred countless of people
Oh
into the
wow.
office and she's got her life back. And it was pretty bad because it was her face. Like you
Mm,
can't cover it up if it's under your shirt or anything. So she was very grateful for that. And that's like something you don't even think of that can help it.
you're right. You're
But
right.
yeah, I've had seizures that this one girl came in and she was having, it was an emergency. She was having a seizure all day. They brought her in. She was having a seizure. Took the x-rays as best I could. And then we laid her on the table and got her adjusted. And after I wish I had this on video. After 1 minute, the seizure stopped. And it was one of the most amazing things I've seen.
Oh,
So you see a lot of amazing things happen. And I get a ton of post-concussion cases because that's my story and people resonate with that. So I see a lot of post-concussion symptoms clear up. But if you name it, people have gotten better from it.
wow. So is this something that you would recommend everyone do, or just people who have had
For
some sort of—
sure.
Okay.
For sure. There's a couple so I bought a practice from a woman that was doing this for 34 years. And I think in the course of her span of doing upper cervical chiropractic, she saw about 5 adults that were in alignment. So, I mean, what does that tell you? That tells you that most people are walking around out of alignment that could definitely
Wow.
use a boost. Even if you're not, if you're healthy, if you're not feeling well, if you're feeling well, your body can still get to that next gear and function properly.
Yeah.
And I have a ton of people too that come in. They're like, "Oh, I'm always tired, but it has nothing to do with this. So I don't even know why I'm telling you that." And and they you get the nerve flow back, and the energy levels pick up. So absolutely, it can miracles happen. You can really everybody could definitely use it for sure.
Oh, wow. I'm so excited to hopefully try this. Please do send me
Yeah,
information on anyone in Maui.
absolutely. Yes.
Um, and wow, just thank you so much for bringing your story forward and telling us
Yeah.
your vulnerable
Yeah.
parts and
That's
bits.
I love doing that. I love when people come on my podcast and just lay out all the cards on the table and don't hold anything back, because
Yeah,
there's a certain realness to that and people really connect with that.
true.
So
Oh,
I try to do the same thing.
lovely. You totally do. So, where
Thank you.
can people find you?
So I have a podcast called Expect Miracles. You can find that on any music podcast listening platforms. I have a website, drkevinpecca.com, drkevinpecca.com. I'm on Instagram at Kevin Pecca, Pecca. Facebook, Montclair Upper Cervical. Facebook, my name again.
Hmm.
YouTube, Dr. Kevin
Oh,
Pecca. I'm
wow, you're
everywhere. Just
everywhere.
just just type in my name and you'll haven't started any TikTok yet. I kind of want to.
You should. You absolutely
I know.
should.
I definitely want to get on that. That's probably the only thing I'm not currently on.
Yep.
But yeah, just
Great.
type in my name on any platform and I have content there.
Cool. Wow.
Yeah.
Amazing. Well, thank you so much again for coming on, and we will
Thank you for having
definitely,
me.
of course, yeah, we'll definitely stay in touch.
Absolutely. Thank you so much, Megan.
All
Best of
right.
luck to the podcast. You're
Thank
doing some
you.
great things, and thank you so much for having me.
Of course. All right. Have a beautiful day.
Thank you so
Bye.
much. Bye.